Welcome back. This is Khan of the ACL Academy, and today we're going to touch on the importance of kneecap mobility, especially when it comes to getting your knee moving after your ACL injury and surgery. Before I get into that, please like and subscribe to this video, share with a friend, subscribe to the channel, and you'll see more and more videos like this. So what I want to touch on today, again, when most people think about the knee joint itself, they think about the shin versus the thigh. Another important joint, very, very closely related to this, which comprises of the knee joint itself, is the kneecap and its relationship to the thigh and shin bone as well. So after an injury and surgery, a lot of times people focus on moving the shin on the thigh bone. But in order for the knee to bend and straighten the way that it's supposed to, the kneecap has to glide a certain way. And after injury, after ACL reconstruction, the tissues surrounding the kneecap can get very bound down and tissues can be limited. So in today's video, what I'm going to show you is how we get these things moving to help restore your range of motion successfully. Okay, so here you're looking at a side view of my knee, right? And what I want to teach you guys to get very familiar with your kneecap. So you can do this by taking your index and thumb on both sides and almost kind of outlining the shape of it, right? So you should be able to find the bottom ridge here, okay, and then along the sides here as well as the top, all right? So you want to be able to feel all sides because it's going to help you when you start to do some what we call mobilizations to get the kneecap moving. Okay, when you do get injured, when you do have surgery, yes, you're going to have a little bit more swelling here and it'd be a little bit more difficult. But what you can do is go to the other leg, right? Feel what it should normally feel like and where to get an idea of like the top, the bottom, and the sides. And then you'll come to the post-surgery leg and then be able to kind of feel around, right? So when the knee is straight like this, the kneecap actually floats on top of the joint, so there's no connection. And as I bend more and more, the kneecap is going to come more in contact with the bones below it. So when we're looking at patella mobility, right, particularly when we're working on the straightening and the bending, there is a certain glide to it. So meaning when my knee goes straight, we're focusing on the kneecap glide going up. So as the knee goes straight, you'll see if you look closely at the top there, the kneecap tracks up. So the quad muscle, what it does, it comes over the kneecap, so it'll pull it as I squeeze my quads. So when I'm working on the straightening, right, I'm not only stretching this thigh bone on the shin bone, I also need to traction the kneecap up. So we call this a mobilization. So when we're working on straightening, the kneecap glides up. And it's not going to be a super amount of movement, but having said that, you should still feel underneath your fingertips movement there. And what I'll instruct you to do is go to the other side, right? If this is the healthy leg, you start moving, see what normal tissue feels like, and then you can compare it to this side as well. And then you can compare the side to side shift as well as the down shift as well. So I would take my thumbs here and push down. So just to clarify, as my knee goes into extension, the kneecap glides up. As I start to bend, the kneecap is going to start to glide downward towards the ankle there. Okay, this is super, super important as you're working on your knee range of motion, especially early on after ACL reconstruction. And when we're working on the straightening, we're working on the up. When we're working on the bending, we're working on the down glide there. Okay, so if I wanted to mobilize or stretch when I'm going into extension, what do I do? You're going to take your fingertips, you're going to find the bottom ridge, right, of the kneecap itself. You're going to place those fingertips right on the bottom ridge, okay, and almost traction, right? Feel it underneath your fingers. You're going to take the other hand on top, And what we're going to do is pull all the way towards our chest. Okay, nice and easy. We want to feel the end range there. Once we're at the end where we feel like it stops, okay, that's where our starting point is going to be. And we want to hit that end range each time in order to increase. So fingers on top, and what we're going to do is a pulse. So we pull, find the end range, and then we're going to pulse in and out of it, okay? And what I would instruct you to do is do anywhere from 30 to 50 pulses, and really you can start to be aggressive here. You shouldn't feel any pain or discomfort, and we're working on the movement. So after about 30 or 50, you can take a little break, okay? Give the knee a little breather, and then once you're ready again, give your hands a breather as well. And once you're ready again, fingertips underneath the kneecap, traction on top, pull, find the end range, find that end point. Once you're at that end point, you're going to pulse, hitting that end point each time. And again, we're going 30 to 50 pulses there, non-stop. Okay. Now, if I wanted to work on the bending, it's the opposite. So as I bend my knee, the kneecap glides down. So if you're restricted, let's say, for example, if you can only bend, let's say, to about, 15 degrees or so, you're early on in the process, you should start at that restriction point. So you can start here where you can feel the kneecap move, and you'll see what I do is take my thumbs. Now I find the top ridge of the kneecap, and I'm pushing downward. So you're going to see, you're going to find the end point, and I'm going to work in that down direction. Same thing, I'm doing pulses, 30 to 50, and then we'll take a break. Now, because I'm working on the bending, we want to slowly after we work it, straight, we want to slowly work it to the range that we can get. Right, so if, let's say here we feel the restriction, like we can't move past this point, we'll let the knee rest here. We'll do the same thing, take our thumbs on top, right? And to get a little bit more aggressive, we can take the palm of our hand on top of the kneecap there, come over the top like we did with the extensions, and now we're pulsing this way. We're going to find the end range, and then we're going to pulse 30 to 50 times in that direction. We'll take a breather after that, and then we'll see if we could even bend a little more, right? If we could bring it up a little bit more. Find that new range, take the heel of our hand again on top, or your thumbs if you feel more comfortable there. I just feel like you'll get a little bit more aggressive using the heel. Put it right on top, put the other hand on top. Again, finding the end range first, and then we're pulsing. 30 to 50 times. And once you've done that, you would take up the new range and then repeat. So some super key points there. Again, explaining the importance of your kneecap and how it should move when we bend and straighten, and getting that kneecap moving, especially after surgery. Now, with extension, remember the kneecap glides up towards the hip. With flexion or bending, right, the kneecap glides down. So get familiar with your kneecap. If you're swollen and it's hard to find, go to the other side, feel around there on the other leg. At least this should give you an idea where the bottom, the top ridge, and the two sides are, and then go back to the recovering side there so you can do your mobilizations. So key factors, the knee is two joints, the shin and the thigh, as well as the kneecap and its relationship to the shin and the thigh. And it's so important to get that kneecap moving, especially to just restore your full range of motion. Thanks for tuning in, guys. Please like the video if this was helpful. Comments, any questions that you have, and please subscribe to the channel for more videos like this.